Hi, my name is Apple, and I'm one of the rheumatology specialist nurses at the RNHRD. This film is to give you more information on oral methotrexate. Methotrexate is a disease-modifying anti-rheumatic drug, or DMARD for short. It works by reducing the activity of the body's immune system, which may be overactive in some conditions. It is usually prescribed in rheumatology for inflammatory arthritis such as rheumatoid arthritis, psoriatic arthritis, lupus, and other rheumatological conditions. It isn't a painkiller, but it helps to reduce inflammation, control symptoms, and prevent long-term joint damage. Methotrexate is usually given as tablets once weekly, together with folic acid tablet, which is not taken on methotrexate day to help reduce side effects. You'll usually be given a starting dose of methotrexate of 15 mg while we try to bring your condition under control, but this might be increased if it isn't helping your symptoms. For safety reasons, methotrexate is prescribed as 2.5 mg tablets, so that means for a 15 mg dose, you will take 6 small tablets all in one go once a week on the same day each week. If you experience significant side effects, we may consider increasing your folic acid and/or switch oral methotrexate to injections. Methotrexate might not work straight away, so it's important to continue taking it even if it doesn't seem to be working at first. Your symptoms should start to improve after 8 to 12 weeks of regular treatment. You should continue taking it as prescribed even when your symptoms are improving and you start to feel better, as this will keep your condition under control long-term. When you start methotrexate, you can carry on taking any non-steroid anti-inflammatory drugs, painkillers, or steroids if needed. Before prescribing methotrexate, you will also be checked for previous HIV and hepatitis B and C infections, as this drug can increase the risk of these infections starting up again. If the test is positive, then you may need antiviral treatment first. You may also need a chest X-ray to also check for any lung disease. The most common side effects of methotrexate includes nausea, vomiting, headaches, mouth ulcers, gastrointestinal discomfort, tiredness, and thinning of the hair, as well as rare but serious risks such as lung inflammation, liver problems, and suppression of blood cells. To ensure safety, you will be required to have a regular blood test monitoring. Please check your clinic letter for details of these blood tests and when they need to be done. You should make an appointment for these blood tests at your GP surgery when they are due. You should tell your rheumatology team if you develop any unexplained bruising or bleeding or yellowing of the skin called jaundice or any new symptoms that concern you. Alcohol and methotrexate can both affect your liver, so it's important that you don't drink more alcohol than the government's recommended limit. This is 14 units of alcohol a week spread throughout the week rather than having them all in one go. If you smoke, it's worth cutting down or preferably giving up, as smoking can make your inflammatory condition worse and prevent the methotrexate from working optimally. Methotrexate at any dose should be avoided in pregnancy and stop at least 3 months in advance of planned conception. Methotrexate is also not recommended while breastfeeding. If you become pregnant while taking methotrexate, please contact the rheumatology team immediately. If you get chickenpox or shingles, then you will need treatment and you should contact your GP or 111 without delay. These illnesses can be worse than usual if you're on methotrexate. Because methotrexate affects your immune system, it can also make you more likely to develop infections, especially on higher doses. Methotrexate should usually be stopped if you have serious infection and restart once fully recovered and free of infection. We recommend that you have the one-off pneumonia vaccine, the yearly flu vaccine, non-live shingles vaccine, and the COVID vaccine. If you are on higher doses of methotrexate or a combination of rheumatology medications, then we usually advise that you don't have live vaccines. Please contact us if you're unsure about whether or not you should be having a vaccination. For invasive surgery or major dental procedure, you should inform your surgeon or dentist that you are taking methotrexate. For most minor procedures, you can continue taking methotrexate, but please make your clinical team aware that you are taking this medication. Thank you, and I hope that you have found this information useful.